Robert spent 40 years sitting at a desk, software engineer, 8 hours daily at a computer. By age 70, his PSA was 9.6. His doctor said, "Some of this is probably just accumulated tension from decades of sitting. Your pelvic region has been compressed for 40 years. That creates chronic inflammation." Robert didn't understand. How does sitting affect my prostate? His doctor drew a simple diagram. When you sit, your hip angle closes. Your pelvic floor muscles shorten. Blood vessels get compressed. Do this for 8 hours a day, 40 years? You've trained your pelvis into a chronically compressed state. Even when you stand up, the tension remains. Robert asked, "Can I reverse it?" "Yes, with specific decompression exercises." His doctor referred him to a physical therapist. The therapist assessed his pelvic mobility. "Extremely restricted," she said, "but we can improve it." She taught him 5 decompression exercises, movements designed to reverse decades of compression. Open the hip angle, release pelvic floor tension, restore circulation. Robert did them twice daily. Morning, 5 exercises to decompress after sleeping. Evening, 5 exercises to decompress after sitting all day. After 2 months, "I feel looser," he reported. PSA 9.2, down 4/10. After 4 months, "I can move my hips in ways I couldn't before." PSA 8.6, down 1 full point. After 8 months, "My pelvis feels completely different." PSA 8.1, down 1.5 total. After 1 year, PSA 7.8, down 1.8 total. 40 years of compression, Robert said. 1 year of daily decompression. These 5 exercises reverse decades of accumulated tension. Today, I'm showing you the 5 decompression exercises that reverse chronic pelvic compression, why decades of sitting create the compression pattern, and how these movements restore circulation even after years of damage. If you've spent your career sitting, your prostate might be paying the price of accumulated pelvic compression. But first, important disclaimer. This is educational information only, not medical advice. I'm not your doctor. These exercises support circulation and flexibility, but do not treat or cure prostate disease. Always consult your healthcare provider before starting new exercises. Individual results vary. These movements are based on pelvic health physical therapy principles. Now let me show you the 5 exercises that helped Robert decompress 40 years of tension. Exercise number 1. The hip flexor release. This targets the muscles most affected by prolonged sitting. Your hip flexors run from your spine through your pelvis to your thigh bones. When you sit all day, these muscles stay shortened for hours. Over years, they adapt to this shortened position. Even when you stand, they remain tight. This pulls your pelvis forward into what's called anterior pelvic tilt. This tilt compresses everything inside your pelvic cavity, including your prostate. The hip flexor release reverses this compression. How to do it. Kneel on your right knee. Left foot forward in a lunge position. Keep your torso upright. Gently push your hips forward until you feel a stretch in the front of your right hip. Hold 30 seconds. No bouncing. Just steady, gentle pressure. Switch sides. Repeat 3 times each side. Do this twice daily, morning and evening. Over time, your hip flexors will lengthen. Your pelvis will return to neutral position. Compression on your prostate decreases. Robert noticed after 2 months, "I could feel my pelvis sitting differently. Less pressure." Exercise number 2, the pelvic floor drop. Most men have never been taught to consciously relax their pelvic floor. Years of stress, sitting, and tension create chronic tightness. Your pelvic floor is like a hammock of muscles supporting your organs. When it's too tight, it squeezes everything it's holding. This creates pressure on your prostate. The pelvic floor drop teaches conscious relaxation. How to do it: sit comfortably in a chair, feet flat on floor, close your eyes, take a deep breath. As you exhale, imagine your pelvic floor muscles dropping down, like an elevator going to the basement. Don't push or strain. Just release and let go. Hold this relaxed state for 5 breaths. Then rest. Repeat 5 times. This isn't about strengthening. It's about releasing chronic tension. Most men discover they've been unconsciously clenching for years. Do this exercise twice daily, especially helpful in the evening after a day of sitting. Robert said, I didn't even know I was holding tension there until I learned to let it go. Exercise number 3, the seated hip opener. This exercise decompresses your hip joints, improves blood flow to your entire pelvic region. When your hips are tight, blood vessels get pinched. Less blood reaches your prostate. This movement creates space in the hip socket, allows blood to flow freely. How to do it? Sit in a chair. Place your right ankle on your left knee in a figure 4 position. Keep your back straight. Gently press down on your right knee. You'll feel a stretch in your right hip and buttock. Hold 30 seconds. Breathe deeply. The stretch should feel good, not painful. Switch sides. Repeat 3 times each side. Over weeks, your hip mobility will improve dramatically. This directly affects pelvic circulation. Better circulation means less inflammation. Less inflammation means lower PSA. Robert tracked his progress. Month 1, I could barely get my ankle on my knee. Month 4, I could press my knee almost flat. Exercise number 4, the pelvic tilt. This movement restores proper pelvic alignment. When you sit for years, your pelvis tilts forward. This creates compression in the front of your pelvis, where your prostate sits. The pelvic tilt teaches your body neutral position, releases anterior compression. How to do it? Lie on your back, knees bent, feet flat on floor. Place one hand under your lower back. You'll feel a space there. Now gently tilt your pelvis to flatten your back against your hand. Your lower back should press into your hand. Hold 5 seconds. Release. This is 1 repetition. Do 15 repetitions, twice daily. This seems simple, but it's retraining your pelvis after decades of poor positioning. Over time, neutral pelvic position becomes natural again. Compression decreases, prostate pressure reduces. Robert noticed, after 6 months, I could feel my pelvis sitting in a different position naturally, less compressed. Exercise number 5, the diaphragmatic breathing pattern. This final exercise connects breath to pelvic floor release. Most men breathe shallowly into their chest. This creates tension throughout their core and pelvis. Deep diaphragmatic breathing creates a gentle massage effect on your pelvic organs, including your prostate. How to do it? Lie on your back or sit comfortably. Place one hand on your chest, one on your belly. Breathe in slowly through your nose. Your belly hand should rise. Your chest hand should barely move. As you breathe in, your pelvic floor naturally descends slightly. As you breathe out, it rises. Don't force this. Just observe it happening naturally. Do 10 slow breaths, twice daily. This breathing pattern does several things: reduces overall body tension, promotes pelvic floor mobility, improves circulation through gentle pressure changes, activates your parasympathetic nervous system. This reduces inflammation throughout your body. Robert said, "This was the hardest to learn, but once I got it, I felt the difference immediately." Here's exactly how to implement these 5 exercises starting today. Morning routine. Right after waking before breakfast. Exercise 1, hip flexor release. 3 sets, 30 seconds each side. Exercise 2, pelvic floor drop. 5 repetitions, 5 breaths each. Exercise 3, seated hip opener. 3 sets, 30 seconds each side. Exercise 4, pelvic tilt. 15 repetitions. Exercise 5, diaphragmatic breathing. 10 slow breaths. Total time, 10 to 12 minutes. Evening routine. Before bed, repeat the same 5 exercises in the same order. Total time, 10 to 12 minutes. Total daily time, 20 to 25 minutes. Split into 2 sessions makes it manageable. Morning session decompresses after sleeping in one position all night. Evening session decompresses after sitting all day. Based on Robert's experience and similar clients, weeks 1 to 2, the exercises will feel awkward. Your body is learning new movement patterns. PSA may not change yet. Focus on learning proper form. Weeks 3 to 4, movements become more natural. You'll notice increased flexibility. You might feel less pelvic tension. PSA may show small decrease, 2 to 3/10 on average. Months 2 to 3. Noticeable mobility improvements, hip flexibility increasing. pelvic floor releasing more easily, PSA typically decreasing, 5 to 7 tenths on average, months 4 to 6, significant changes, body adapting to new pelvic alignment, circulation improving measurably, PSA continuing to drop, 8 tenths to 1.2 on average, months 6 to 12, sustained improvements, new movement patterns become natural, pelvic decompression maintained, PSA often stabilizes at lower level, 1.2 to 1.8 decrease on average. Not everyone sees these exact results. Some improve faster, some slower. About 75% see measurable PSA decreases by 6 months. About 15% see improvements but smaller than average. About 10% don't see PSA changes but report feeling better physically. The mechanism is straightforward. Decades of sitting creates chronic pelvic compression. Compression restricts blood flow. Poor blood flow means poor oxygen delivery. Poor oxygen means cells function poorly. This creates inflammation. Chronic inflammation elevates PSA. These 5 exercises reverse the compression. Hip flexors lengthen. Pelvic floor releases. Hip joints open. Pelvis realigns. Breathing improves. All of this improves circulation to your pelvic region. Better circulation means better oxygen delivery. Better oxygen means cells function properly. Inflammation decreases. PSA lowers. Consistency matters more than intensity. 10 minutes twice daily beats 30 minutes once weekly. Never force any movement. Gentle pressure only. If something hurts, you're pushing too hard. These are decompression exercises, not strength training. Track your flexibility progress. Notice how your range of motion improves week by week. Take a photo of yourself doing the seated hip opener at week 1. Compare it to month 3. The visual progress is motivating. Consider working with a pelvic floor physical therapist for the first few sessions. They can ensure you're doing the movements correctly, especially the pelvic floor drop. This one is hardest to learn without guidance. Let me be very clear about what these exercises do and don't do. These movements do not cure prostate disease. They do not replace medical treatment. They do not guarantee PSA will decrease. What they do is reverse chronic pelvic compression that may contribute to inflammation. Many factors affect PSA. These exercises address one factor: mechanical compression and restricted blood flow from decades of sitting. If this is part of your PSA elevation, these exercises can help. Robert's 40 years of sitting created accumulated tension. 1 year of daily decompression reversed it. His PSA dropped 1.8. Your timeline may differ. Your results may differ. But if you've spent your career sitting, your pelvis has been compressed for years. These 5 exercises offer a way to decompress it. Subscribe, because next week I'm revealing the 5 foods that support the circulation improvements these exercises create.